Hello, my name is Wendy Tyler-Batt and I'm a clinical pharmacist working in primary care in Gloucestershire Integrated Care System. And I'd like to share with you what I've been doing towards greener healthcare and sustainability. I have previous experience in all sectors, but for the past 5 years I've been working as part of the small parachute clinical pharmacist team in Gloucestershire, working across GP practices short term. It's a patient-facing role and everything associated with safe, cost-effective and evidence-based prescribing, always involving shared decision-making. And probably like many of you, I was extensively involved in the COVID-19 vaccination programme. When I came to the Clinical Pharmacy Congress in September 2021, I had a bit of a light bulb moment. I met this incredibly inspiring group of climate-conscious pharmacy professionals, Pharmacy Declares. And I realised that although I was environmentally aware in my personal life, that I had been doing nothing about it whatsoever in my work life, apart maybe from being obsessed with wastage. So I felt energised and motivated to effect change immediately. And the challenge for me was to go back to my workplace and find like-minded colleagues and to do something. So although I was aware of the Greener NHS's net zero carbon target by 2040-2045, what really shocked me was to be made aware of the carbon footprint in primary care and the fact that over 60% was down to pharmaceuticals, of which 13% was attributable to the propellants from metered dose inhalers. So it made me realise what a huge part that pharmacists and the pharmacy team had to play in contributing towards reducing that and sustainability. So back in Gloucestershire, I found that our integrated care system had a sustainability group, which was producing a green plan, which is required as part of the Greener NHS for 31st of March 2022. That we had a local greener practice group that had recently been set up, and they were talking about a green impact for health toolkit. And on neither of these was the pharmacist representation. I also found that there was a greener practice, a national group with a respiratory subgroup, and there were lots of resources on this website, and it was really useful to be part of that for networking. So I joined all of those. But I realised the first thing I could do immediately was to change the conversations that I was having both with colleagues and with patients. And I also wondered about the clinical pharmacists and the pharmacy team. What was their concept of the carbon footprint? How aware were they? And I put together a presentation to discuss this with them at different meetings. And within the local greener practice group, we soon formed a greener prescribing subgroup. And we recently put together the first quarterly review for the end of March with comparative data and ideas and offers for support as to how we could support other practices in reducing their carbon footprint and improving sustainability and greener prescribing. And we also talked more about the Green Impact for Health Toolkit, more of which later. So, shared decision making and changing conversations. This statement nicely encapsulates that what we are actually already doing contributes towards sustainability and greener prescribing. All medicines optimization processes deliver sustainability gains. Any single process which helps patients to enhance their therapy, regain their health and prevent readmission has distinct environmental benefits. So at the Primary Care Network and the Primary Care Network pharmacist meetings, the presentation that I put together included talking about what the carbon footprint is, the climate emergency, the impact and investment fund and the greener measures that we have to help us measure our progress, inhaler prescribing and structured medication reviews, and how the clinical pharmacy team can increase awareness of greener practice and sustainability. So just touching on the carbon footprint briefly, because there are multiple resources out there to find out more. But the carbon footprint, in essence, is the total greenhouse gas emissions caused by an individual, organisation, event, service, place or product expressed as the carbon dioxide equivalent. And it is this carbon dioxide increase that is causing the Earth's temperature to rise. So some notable figures are the fact that the NHS produces 5% of the UK footprint, and of that medicines contribute 25%, and 78% of prescribing occurs in primary care. And in primary care, 61% of the carbon footprint is down to medicines. In primary care, we have the IIF, the Investment and Impact Fund. This is part of the Network Direct Enhanced Services contract, and if targets are achieved, there are financial rewards. So similar to QOF at GP practice level. And there are two particular domains that support the greener NHS and sustainability with respect to prescribing. Domain 3, a sustainable NHS, and Domain 2, providing high quality care. And in this one, there are the 9 SMR indicators and 2 respiratory indicators, including the number of short-acting beta-agonist inhalers prescribed. So within the D3, the greener NHS sustainability domain, there are 2 indicators, ESO1, where the target is downwards to reduce the number of metered-dose inhaler prescriptions as a percentage of all non-salbutamol inhaler prescriptions. So ideally achieving 35%, but the uppermost that we should be achieving is 44. And you can see at the moment, I've put our figures in for Gloucestershire, we're at 56%, so still some way to go. And then ESO2 looks at reducing the mean carbon emissions per salbutamol inhaler prescribed. So in other words, prescribing salbutamol inhalers with a lower carbon footprint. And the targets there are between 22 and 18 kilos of carbon dioxide equivalent. And we're doing well in that in Gloucestershire in the sense that we are already at 20 kilos. So how do we measure our progress with these indicators? Well, in addition to any data that you may be supplied with locally from your ICS Medicines Optimisation team, there is the Open Prescribing website, which if you haven't discovered it will be a revelation. It is incredibly powerful, supplying information at national level, at ICS level, primary care network level, down to GP level. So you can go and look at your practice, look at how your practice is performing within the PCN, within the ICS, against national data. So very, very helpful. And for each of the measures, it does this. It gives you why the measure has been included with links to the evidence and the rationale for that. So for example, this one for the lower carbon footprint inhaler prescribing, the NHS is committed to reducing its carbon footprint by 51% by 2025 to meet the target in the Climate Change Act. So that includes a shift to using dry powder inhalers over metered dose inhalers, which contain the powerful and damaging greenhouse gas propellants. So looking at, and it organises the practices in mean percentile over the past 6 months, with the worst performing at the top. So here we are looking at Gloucestershire's for ESO1. The red line is where the Gloucestershire CCG sits. The bolder dotted blue line is the national median. So you can see that we are above the national median at the moment. And then on the right hand side is one of our star practices, Cam and Uley Family Practice. They started working on this indicator quite some time ago, and you can see that they have made incredibly good progress. And this, I hasten to add, has not been through any mass switching, but through patient engagement and shared decision making. So it just shows what can be done. So we use the open prescribing data, which you can download into a spreadsheet and manipulate, to produce this bar chart here. So this is for each of our practices. We use this and put this data, this table, into the greener prescribing bulletin, our first bulletin. So the green is where we all want to be. And if you're in the yellow, then you're between the upper and the lower thresholds for this indicator. And if you've got in the red, then you are above the IIF target. So you can see that for Gloucestershire, 2, in fact more now, of the practices have actually achieved the target of less than 35%. There are some in the amber zone with less than 44, but the majority, unsurprisingly, and bearing in mind this data is also 2 months behind, are above that target. So we're going to produce this at each quarter so that practices can see how they're getting on, both for themselves and in relation to the other practices too, and then share good practice as to what they've done and how they've managed to achieve that. So hopefully being incredibly supportive to them as well. Just recently, halfway through May, we had the new greener measure being helpfully produced by Open Prescribing for the average carbon footprint per salbutamol inhaler, so supporting that ESO2. And again, here it says the rationale for the inclusion of this measure, and it links to a table which is from Prescript, which gives the carbon 2 emissions per salbutamol inhaler. So you can see from this table that we want to be avoiding Ventolin, which has a carbon footprint of 28 kilos of carbon dioxide, and you also want to be avoid prescribing generic salbutamol CFC-free inhaler, because that will have 25 kilos attributed to it. So ideally we want to be prescribing the dry powder inhalers, but of course above all is the patient's disease control, and if they are unable to manage a metered dose inhaler, then we need to be looking at prescribing something by brand such as Salamol, which has the 11.95 carbon dioxide kilo footprint. Another incredibly helpful source of information is from the Eclipse database, which your ICS PCN may or may not subscribe to. But this is some software which accesses the patient data from practice IT systems and then produces this suite of incredibly helpful reports, which enables you to target specific patient groups. So you can see on here, there's the inhaler group, there's the SMR pathways, polypharmacy, high-risk drugs. So very, very helpful. And all of this, of course, contributing to keeping patients well and keeping them out of hospital, and so improving sustainability. You will need access as an individual and as a per practice access, but as I say, very, very helpful for looking at the IAF targets. And of course, on your practice systems, there are the inbuilt searches if you have and the inbuilt searches, and also the searches for if you use the Ardens templates, which are also very useful for targeting and looking at specific patient groups. So something that I mentioned earlier was the Green Impact for Health toolkit. This is a free online toolkit, and it looks at all areas of the carbon footprint in general practice, so not just prescribing. There are over 100 actions to improve environmental sustainability quality, as well as saving money. And if you choose to, you can go for one of the awards, and they start at bronze and they go up to carbon. And anybody can sign up to them, and you upload evidence which is then audited. And if you want to, you can test drive the kits with the username and password that on the screen there. So just have a look around, navigate around the toolkit and see what it's all about. But it was just designed specifically for general practice in conjunction with the National Union of Students, Bristol University and Health Education England. And what I hope and think will be a great game changer in Gloucestershire is that we have actually incentivised our GP practices to sign up to this as part of the ICS Green Plan. So taking a closer look at the Green Impact Toolkit, this is the first page, and this is from one of our practices. And as you can see, there are different target areas, and here they are all listed, and you can look at each one in more detail. So there's prescribing, there's water, travel and exercise, quality improvement projects, zero carbon, energy saving, just simple things like switching off lights, not putting the heating on when you don't need it, all that sort of thing, waste and recycling, it's all in there. And as I say, it's a whole team approach and everybody can get involved. And one of our practices, Church Street Medical, they've recently achieved their bronze award. Just looking at the prescribing targets, you can see that these are actually also supporting the IIF, and which in turn, of course, is supporting sustainability and greener prescribing. So the first one there, team CPD education has taken place on green inhalers. The practice has reviewed its data on dry powder inhaler versus MDI preventer inhalers and high versus low volume salbutamol use. So all really useful stuff, and just building on what we're hoping to do, we should be doing anyway. So the level there says whether it's bronze, silver or gold, and then the number of points is in the right hand column. But whether or not you choose to go for the awards, just using this as a framework is a really helpful thing to do. So this is data from one of our practices, Cam and Uley family practice. Now they embarked on this path quite some time ago, and this is the difference between October 2020 and October 2021, the savings that they managed to make on the things that they could measure. So overall, they calculated that they had saved 53.9 tonnes of carbon dioxide equivalent. But interestingly, you'll see that 45 tonnes of that, which is 85%, was down to the changes they made in prescribing from meter dose inhalers to the dry powder inhalers. So again, it shows what a huge impact and contribution we as pharmacy teams can have on the carbon footprint in primary care. So I mentioned earlier how I had joined our ICS Green Plan sustainability group, and that as part of the Greener NHS to embed sustainability across the system, that each ICS was required to have a green plan in place by the end of March 2022. So within Gloucestershire, under workforce and systems leadership, which is very much following the Greener NHS sort of layout, for primary care, we've got that we are incentivising our GP practices to sign up to the Green Impact Award, and we're going to facilitate and help them by developing communication engagement plan, which we've started doing now, and also campaign for wider recruitment of green champions within each of the GP practices, because it's really important that you have somebody leading on this in each of the practices. And an awful lot of this is not about extra work, it's just about doing things slightly differently than we're doing at present, and being more aware of how to save energy and be more efficient, which generally also saves money. So it is a win-win. And the GP practices will undertake to report on actions within the Green Impact Toolkit. So that's under workforce and systems leadership. Then under sustainable models of care, and this includes primary care and also our acute trusts as well, we have included here reducing the metered dose inhalers prescribed by 25% by 2025. And the key thing here is supporting this, but making sure that the first thing is that the patient is assessed for their inhaler use, that they're using their inhalers properly, that they they are only changed to a dry powder inhaler from a meter dose inhaler if it's clinically appropriate, because their disease control is what's paramount. So far, everything really has been about reducing carbon footprint, and that's incredibly important to halt climate change and the increase in temperature. And that's what the Green NHS is all about. It's reducing carbon to net zero by 2040, 2045. But as you can see from this wave cartoon, that's only one of the waves that we need to flatten. And the other one is the biodiversity collapse, which is partly due to climate change, but it's also due to destruction of our ecosystems by other means, including pollution. And by pollution, I mean macro and micro pollution, And again, pharmacy and pharmacy teams have a huge part to play in this as well, to ensure that wherever possible, patients are made aware of safe disposal of their medicines and of their blister packs. And when I say medicines, that includes inhalers. So many patients are not aware that inhalers should be returned to the pharmacy for safe disposal, which at the moment for the majority of them means incineration. But that's far better than meter-dose inhalers going to landfill, where the greenhouse gases leak out and contribute to climate change. We know that 70% of our surface waters are polluted. So again, it's all about educating patients and also about being proactive where we can, that checking that prescribing is necessary, and that more and more considering alternatives to prescribing. Sustainability actions that you might like to consider should include becoming carbon literate, a key priority, so that you have a feel for what's a low and a high carbon activity. And this can be done through an online course or via a website. Those shared decision-making, medicines optimization conversations that you have with patients, including sustainability as part of those, including talking about non-medicines alternatives, lifestyle, and green social prescribing. Do you know what's happening in your GP practice or at your PCN level as regards greener prescribing and sustainability? Have you seen your ICS Green Plan? Has a pharmacist been part of that? And what about signing up to the Green Impact for Health toolkit if you work in a GP practice, or finding if they have already done so and whether you can contribute to the prescribing indicators? Maybe think about joining Pharmacy Declares. We're a friendly bunch. We have a good website, we have bi-monthly talks, and we have a Telegram group, and we do quite a bit of tweeting as well. So great source of support and also information. And likewise with the Greener Practice group, you might find that you've got a local Greener Practice group, and certainly the national group has plenty of support and resources via its website and WhatsApp groups. Another great source of information is the Greener NHS Knowledge Hub in NHS Futures. So you can follow the conversations there and see the exchange of ideas and get a feel for what is going on. Waste and recycling, as mentioned earlier, is a huge issue. And again, it's a question of not just looking at what you're doing and telling your patients, but also linking up with community and hospital pharmacies too. Think about communicating to your patients about ordering and safe disposal of medicines. So this could be via an AccuRx text to all your patients. It could be by putting up a poster in the waiting room, supplying that poster to the community pharmacies, maybe discussing with them, or putting a message on the practice website. Also think about promoting active travel, hybrid working. Many of us were working from home, at least for part of the time during the pandemic. Is that still possible now that we're not necessarily seeing so many patients? A mixture of working from home and then working at the practice and being part of the team, so that you maintain those personal links. That can work quite well. And above all, getting embedded this reuse and recycle mentality is really important. So I want to share with you some of my key learning points to date on my short journey, which has only been since September 2021. First of all, my surprise at the underrepresentation of pharmacists or a pharmacy team member on sustainability greener practice groups, when such a large proportion of the primary care footprint is down to prescribing. Secondly, finding that patients are such great allies, both in consultations. It's been very empowering and refreshing to talk about greener practice and sustainability with them. The patient participation groups can also be a great source of support, and for example in one practice they are raising funds so that we can have another box to recycle blister packs. Really helpful to document any conversation that involves sustainability and greener prescribing in the patient notes, and to use the AccuRx text function to communicate conversations with patients and supply them with links to useful resources, supporting resources. And I do use every opportunity to include sustainability in discussions and actions, and it's not just about medicines. And of course, if it's in the notes, it means that other people going into the notes, other healthcare professionals, will see that this has been discussed, and it just raises the awareness and the noise level of sustainability and greener prescribing. I found joining groups and networking hugely supportive, and of course I have to appreciate that others are at different stages in their journey. But when you knock at the door and nobody answers, don't be disheartened. Always remember the power of one. Who would ever have thought that an autistic girl from Sweden would have started up a movement, a worldwide movement with concern about planetary health? Social media, great support of information and support, whether that's through Telegram groups, through WhatsApp or through Twitter, but really, really useful. So this is just a little summary, a little timeline of the things that I have been involved with and what I've been doing since September of last year. And none of this is officially on my job description, but then of course I would venture to suggest that sustainability and greener prescribing is part of any pharmacist or pharmacy team member's job description inherently because of what we do. And remember that what we are doing and what we have been doing has been contributing to sustainability and greener prescribing, but we haven't been describing it and discussing it and framing it like that. And I think that's something that is a really important thing to do. So in summary then, the climate crisis is a health crisis, and we as respected pharmacy healthcare professionals have a responsibility to contribute towards improved environmental sustainability and greener prescribing. The evidence is clear, the time for action is now, and we know we can halve emissions by 2030. And this statement is from the IPCC report of April of 2022. We are at a crossroads. The decisions we make now can secure a livable future. We have the tools and know-how required to limit warming. And you can see the chart there tracking the global temperature. This is the average temperature since 1850, from pre-industrial times. And we're now at 1.2 degrees. And we know that we need to keep below 1.5 degrees to prevent irreversible damage to the planet and the threat to human society. So thank you for listening. There are a list of references at the end of this presentation, and please do contact us for further information. Thank you.